Can you think of a kind of specific example where some of this work you've been doing with the union has helped somebody, some individual, I don't know, a grievance or any? Can you think of some moments where it's been gratifying to be able to?
Well, absolutely. You know, there's always the issues of grievances for sure, and people who have had, you know, there's always issues of sometimes management getting a bee in their bonnet about a particular person. It isn't necessarily always about their work performance, but just how they feel about that person. And so, you know, as a union person, I've been able to support them in that, and to, you know, make management understand that, you know, they needed to have some basis in their complaints, and that, you know, if they didn't, then they needed to sort of leave off, let that person alone. I don't know, like I think it certainly things like our unit, you know, the Grace went through lots and lots and lots of changes over the years, and you know, at one point they closed half of the hospital, and there was a lot of controversy about what was going to happen to those people. And the union is who stepped in and helped us to get some sort of agreement so that some of those people could stay at the hospital. They had choices. They had somewhere they could go, they could take a package, they could go to another hospital, they could go, but they didn't lose everything that they'd worked for all those years. And so I mean, that's convinced me totally. You know, I've had some disability issues myself, and you know, without the union support in that, you know, I mean, it's just as likely that management would say, well, sorry, we can't help you, you know, but because of what the union has built, they couldn't do that. You know, they had to help you out and help you find a job and support you along the way, and that kind of thing. So yeah, it's just I don't know what it is. I mean, not only are we union colleagues, but I think we all become quite good friends, you know? And so it's really a family kind of feeling behind it.
You've talked a little bit about the kinds of issues that exist in all hospitals in terms of rushing and things that lead to unsafe work situations. We want to take a little time and saying, are there particular things that, you know, examples that you can think of where you've got concerns that you want to see addressed around the safety of patients in the workplace? Well,
I think for sure emergency is really something that has to be looked at. The whole emergency scenario, the length of time people are having to wait, the fact that a lot of people just won't go no matter how sick they are because they don't want to wait 8 or 12 hours to be seen by somebody. You know, how we treat those patients when they appear in the emergency room, you know, not just when they go into a bed in the back, but when they're sitting out in the waiting room, and how they're treated, and how they need to know that someone does care about them, and what's going on with them since they arrived in that waiting room, you know. So, you know, I think certainly, hopefully, there's going to be some changes there, and certainly maybe we can increase our emergency room beds. You know, Health Link, I think, has been really helpful in, you know, decreasing the amount of emergency room visits, and hopefully we'll have more emergency, like urgent care centers set up throughout the cities so that they have other places to go after hours. You know, most walk-in clinics close at 10 o'clock and that's it, then you got to go to emergency. And so, you know, if we can have more 24-hour urgent care centers, I think that'll make a difference, because not everybody needs an emergency, but, you know, some people still need to see a doctor at 2 o'clock in the morning or whatever. I think, you know, we really, because it's been so busy on the units in the hospitals, there's been less focus on education and policy and, you know, the things that we always worked on together as nurses to make sure that we were doing the best that we could do on a unit. And so I think that really needs to start coming back again. That focus has to start to change, and not so much worry about, well, we only have 10 nurses today and we're supposed to have 13, but you know, we need to work to build our units a little bit and make people feel that they have some kind of ownership on the unit as well, because I think with this short staffing and that a lot of people don't take ownership. They just come to work and they're gone, because they're so exhausted by the end of the day.